Hi, my name is Jade. I'm one of the pelvic floor therapists at UCSD. And today I'm going to be talking briefly about pelvic floor rehab after cystectomy procedure. So, a cystectomy is a surgical procedure where you remove part or all of the bladder, commonly used to treat bladder cancer. In other cases, it can be done if there is a severe bladder infection or possible trauma. Now, our pelvic floor physical therapy team works closely with Bladder Cancer Advocacy Network, BCAN, in regards to education around how pelvic floor physical therapy can be helpful in reducing urinary incontinence, which is a common symptoms that we see and help treat. To improve your bladder capacity, we want to strengthen the pelvic floor muscle. And when you think about contracting your pelvic floor muscle, also known as Kegels, you want to think about kind of like imagine like you're holding your urine in or trying to hold your gas in while trying not to contract your abdominal muscles or inner thigh muscles and most of all your glute muscles. You want to keep those pretty quiet. Now, if you received a neobladder, you have to kind of relearn what urinary urgency feels like. It is also common to see some mucus in your urine because your new bladder was created from intestinal tissue. Now, incontinence after a cystectomy procedure could last up to 6 to 12 months post-surgery, but could resolve over time. Now, persistent incontinence usually happens more at night, and these can resolve for up to 2 years after surgery. However, strengthening the pelvic floor muscles could possibly help the recovery a little bit faster. So, to improve your bladder capacity, as the bladder is kind of stretching, you want to tighten the pelvic floor muscles to give room for it to um, contract and relax. So, while the bladder fills up, what you want to do is you want to contract the pelvic floor muscle. So, I have a model here. So as you can see on the front here, so this is the female pelvis model. That's the bladder right here. As the bladder starts to expand, get bigger, you want to contract the pelvic floor muscles to close the door and allow the bladder to expand. When you do that, it allows the bladder to relax and fill up, which helps increase the capacity. Now, I want to review two main types of urinary incontinence that could happen. Urinary incontinence that happens with movement, such as squatting, lifting, coughing, sneezing, is called stress urinary incontinence. In this case, you want to think about contracting your pelvic floor. So doing your Kegels with your exhale. So as you breathe out, you want to tighten your pelvic floor muscles. By doing this, you are able to manage the change in the abdominal pressure and you're able to prevent yourself from leaking. So next time you anticipate coughing, laughing, sneezing, I want you to think about tightening that pelvic floor beforehand and tighten a little bit harder when you cough, laugh, or sneeze. Now, another type is urinary incontinence when the urge starts to arise. So as the bladder starts getting filled up, you might have incontinence there. In this case, you want to think about quick pelvic floor contractions. I want you to do a pelvic floor contractions about the rate of 1 per second and relax in between. That actually suppresses the bladder spasm and it gives you time to think about, do I really need to go to the restroom or not? At the same time, you want to do some deep breathing and also relax your body. Again, in order to suppress the urge and buy yourself time to get to the restroom without having any leaking. Now, on the other hand, there is the issue of tight pelvic floor muscle. So if you have a neobladder, you have to push a little bit to be able to empty your bladder. And at the same time, the pelvic floor muscle has to relax to let the bladder, I guess everything in the bladder, the content in the bladder to empty out. In order to do this, you want to take a deep belly breath. So inhale, open up your belly, and exhale. And as you are exhaling, you want to think about relaxing your genitals or your anus and think about you're kind of like melting into the toilet or, in a sense, into the ground if you are standing. Now, if any of these symptoms seems to be persisting, you want to come into pelvic floor PT so we could assess you and help you furthermore with your symptoms. In pelvic floor PT, we can help with pelvic floor muscle training, bladder retraining, think about behavioral strategies, and most importantly, incorporate exercises that uses pelvic floor muscles to help you with movements such as squatting, lifting, and then coughing and sneezing.